It's like you integrating with the EMR systems of the hospital to receive all the information about patients. And sometimes you would like to do some changes to receive additional information, or maybe to filter out information, or to have some clarification of the information, because it's not very formatted data, not very clear data. And it's difficult because it's like not in the high-tech world that you can have like immediate response.
Welcome to 20-Minute Leaders. Just sit back, relax, and learn from the leaders of today. It's a journey. Each one is different, unique, inspiring. Let's get started. This episode is powered by J Ventures, a community-driven VC fund in Silicon Valley, in partnership with Lomitech, and sponsored by Homeward Ventures, Hippo Insurance, Upwest, Hillel at Stanford, Leap, and Birthright Excel. Welcome to 20-Minute Leaders. Today we're going to be talking about the U.S. healthcare system. Meet Dina Fine, the Vice President of R&D of TailorMed, a comprehensive software solution with a mission to help patients and healthcare providers tackle the financial challenges of care delivery. Prior to TailorMed, she was Vice President of R&D data collection and B2C at SimilarWeb. She brings almost 20 years of experience in building high-performance, scalable, and robust systems. She's passionate about leading high-paced R&D departments, setting up solid and effective development life cycles with a focus on technological excellence and high standards. Dina Fine, welcome to 20-Minute Leaders, Vice President of R&D at TailorMed. How are you?
I'm fine. Thank you, Michael. Thank you for having me.
Thank you for joining me. We'll dive right into a really complicated, cumbersome, but fascinating subject, the U.S. healthcare system. Really a complicated monster that, technology in the recent years is helping transform through startups like TailorMed. I have quite a few friends that are working in TailorMed, and so I know that I'm in good company right now. And so I'd love to hear from you a little bit about your understanding of, first, what is the complexity that we're aware of in the U.S. healthcare system, but then specifically we'll dive into how TailorMed is helping to fix some of those issues over there.
Yeah. So I was actually very unaware during my life about the complexity of U.S. healthcare. I mean, of course, from the movies that you watch that there is a problem with insurances and Breaking Bad, right? He has the bills, he doesn't know how to pay for it. But it's actually so broken from the root, like the root system of supporting people when they are in a healthcare problem. It's just amazing. Last year, my father was diagnosed with brain cancer.
Oh, no.
And I was just, thinking, the whole family, we had all this stress of researching about the disease and what to do, and hospitals and treatments. And putting on above this complex situation in a family, also the concern for financial payment, like how do you pay for this treatment, or should you choose between living and maybe breaking your financial stability of your family and leaving them without the home, or choosing the treatment? It's awful. It's awful. This is one of the reasons that I joined TailorMed from the first place.
Wow.
So what we do here in TailorMed, we develop a software solution, SaaS, for health providers to help the patients to find financial assistance for their treatments, for the drugs they should cover on their own. And what is interesting in here that no one, usually when he starts the treatment in the United States, actually knows what will be his, it's called out-of-pocket. It means what is the patient himself will need to pay and not his insurance. Okay, it's very unpredictable. You don't know. Okay, you get to the hospital, you start getting some treatment. You never know what will be the final amount of money you should personally pay. Okay.
Now, I want to just dwell on this point for just a second, because, to the average consumer listening to this is ridiculous. Obviously, we're going to be talking about thousands or tens of thousands of dollars. What is the problem with simply knowing how much am I going to pay for the treatment? Why is there this inefficiency? And by the way, as a U.S. citizen myself, having gone through this process, I too know how I didn't know how much I'm going to be paying for whatever treatments I got. It's horrible.
Well, because in every insurance, and you don't have some very clear format and some standard that everyone is using, there is a lot of little
Fine print.
letters, and you don't really know. And also, it's really complex. It's like some are covering just particular drugs and not in other drugs, and some covering doctors only in this network and not in another network. So if you come to the hospital, which is supposed to be in the network,
Right.
but all of a sudden the doctor that treated you is not in the network, then you get a huge bill to pay, even that you didn't know he's out of the network, but your insurance will just not cover it, okay? So it's very complex. This is just an example on how complex it is, okay? But the insurance plan is very, very complex. And if you take like an average American on the street, he will not know what his insurance really covers and what not.
All right. So we know that there's fragmentation. We know that there's lack of transparency. There's fine print. There's a lot of confusion, lots of different formats, which leads to consumers not knowing how much they're going to be spending when we're talking about, life-changing amounts, right? So where do you fit into all of this problem?
So when the patient comes to the hospital, for example, and he's starting to get some advice also from doctors, and he has his diagnosis, and now he has the treatment. We calculate, trying to predict his out-of-pocket expenses, and based on that, we can flag out patients on high risk that we need to help them in first priority. Okay, and then the hospital employers will attend this patient on first priority using our system. Okay, so we're also giving alerts in this high-risk patient, and we're also building a plan how we can help this patient.
Okay, so and that's solving an additional problem, correct?
Yes, you when you know that someone has if you don't have a very high out of pocket, you probably don't need our help, right? You will handle on your own because you have insurance and different other solutions. But once a patient have a very high out of pocket, he needs help. So what we do now in the United States, apparently there is like thousands, tens of thousands of different assistance programs all over the place, and no one single place that you can access this information and to understand what is the system program you're eligible for and what is not.
So there is, as I said, there is a lot of different assistance programs in the United States in no single place to find all of it. So what we do in TailorMed, in addition to the prediction of out-of-pocket and different suggestions for the patient, you are going and searching the internet, different sites, pharma sites, government plans, federal plans, private funds. And we have all of these programs in hand, okay, due to this activity. And then automatically we search for every patient in the system. We search what are the assistance programs that he is eligible for. And there are very different criteria for this assistance program. Sometimes it's income, what is your insurance type, where you live, what disease you have, what treatment you should get. And we do it all in automatic way. And also, in addition, these assistance programs, they are very dynamic. It means that one day you have a funding for some assistance program, but a lot of people already applied and it's finished, so now it's closed. And we need to wait till this assistance program will be opened again. And once it's opened, we send a lot of notification and alerts to the hospitals so they know that for this particular disease, this particular patient, the fund is open now, please apply now for them. Please help them now, because maybe a half day later it will be too late and it will be closed. Okay, so it's a very dynamic world of assistance programs and different kinds that we search the matching between the patients and the programs, and we can help them like real time.
Now, obviously, one of the most complicated parts about this whole system is how fragmented the supply chain is, the different stakeholders, the different incentives. So you're helping obviously the customers, the patients. How do the different stakeholders react to this, and where is TailorMed actually living in the whole system? Is it integrating it with the hospitals, with the healthcare providers? Do the patients come and use the software? How does it actually work?
Yes, we integrate with the health providers because there is a need that there are two needs that we need to answer. First one, and this is our real mission as TailorMed, is to help patients, okay, to
Right.
care assistance. But the second one is the very big problem of American hospitals because they are private hospitals. And if they give care, and they must give care, of course, that everyone that is coming to the hospital will receive help. But if the patient cannot pay, hospital has a problem because he provided service which will be unpaid. And it may lead it to loss of revenues and even to bankruptcy.
Right. That makes a lot of sense. And so tell me a little bit about, the life cycle of TailorMed and what perhaps you learned from working with hospitals, working with healthcare providers. Because I think that's really, there's a lot of insights to be learned from just interacting with such complicated organizations.
Well, yes, the hospitals, I think that what characterizes the hospitals, it's like a bit of heavy organizations. And IT systems and administration on the IT system, it's not very easy to move, to make changes. And this is one of our challenges. It's like you integrating with the EMR systems of the hospital to receive all the information about patients. And sometimes you would like to do some changes to receive additional information, or maybe to filter out information, or to have some clarification of the information because it's not very formatted data, not very clear data. And it's difficult because it's like not in the high-tech world that you can have like immediate response.
Right.
Sometimes it can take months to move like the integration technical project. But from the administration perspective of the hospital itself, that's working with our system, they are very happy that they have this opportunity automatically to help patients because they are trying to help them, but it's like manual process, which is very, very slow. And using our system, it can actually scale their ability to help much more patients.
Right. No, that makes a lot of sense. Now, what is why is this a good time to do this? So in other words, why, where is the technology coming into play here that perhaps a few years ago or more than that, it wasn't, this is something that wasn't really able to be done?
Well, I think it's ability to work with a lot of data. And the ability, on our perspective, the ability to work in the cloud, to be SaaS organization. Because if we needed to deploy some devices or local on-prem solutions, it's very, very hard with hospitals and with the organization, as I described before. So being SaaS in the cloud, web application that the hospital administration can just log in and start working on the system, it's amazing progress that we didn't have like 10 years ago, maybe so easily.
Right.
And of course,
Go ahead.
processing such big data, it's like we have hospitals with hundreds, thousands of patients. And we pull all of this data like nightly, and we process this data and producing insights on this data like daily. This is an amazing progress which technology allows us to do.
Right. And so as vice president of research and development, how do you go about thinking, how to leverage technology really and R&D to really make the biggest impact here? Where do you see your role in the strategy of TailorMed?
Well, I would like to take this system to be much more sophisticated, and we're starting to do so. I would like to involve much more machine learning, artificial intelligence in predicting out of pocket, and predicting high risk patients, or even much more practical problems, tactical problems, like how do you map all of this data from the hospital to formatted data, because
Right.
it's not like very formatted. And I think this is our direction now, to make the system much more sophisticated and smart.
And so as you're navigating within TailorMed, and you're working with the leadership team to work on the strategy and how to then continuously work with the different stakeholders, how does the R&D fit into the discussion about the strategy of where TailorMed is headed next? How much of that is being guided by R&D versus the incentives of the stakeholders? Because here we're talking again about a very special ecosystem that is very, very complicated, regulated, and has a lot of different incentives.
Yes, I think that when working with the stakeholders, I mean, especially in startups, it's usually the matter of balance, because there is a lot of urgencies when you work in startup, and a lot of different requests from different customers that you really would like to keep them happy. And this is versus the long-term solution that I just described, such as how do you invest resources in such long-term solution like AI, because it doesn't have like 1 month to develop this feature. You need to invest in it and to research and to bring a specialist. And this is a bit tricky, but I think as an organization, as a leadership, we all in the leadership team understand what is it that we want to achieve the next year and how we get to it. And this is the R&D responsibility to push for long-term solutions and not only solving crises.
And that makes a lot of sense. And, obviously that there's a lot more that we can talk about, whether it's the healthcare system, or TailorMed specifically, or your work. But I have a few more questions about you, Dina, and I want to get to know you a little bit better. And I want you to take me back to even your childhood. What really fascinated you as a kid? Before perhaps you were an engineer. What really fascinated you in your day to day?
Well, first of all, I was born in Russia, Siberia, and it was a very tough place to grow in. It's most of the time it's a winter and very cold, like minus 35 is the average temperature. And I think that one of the first things that really fascinated me, that it's like every October we had the first snow after the summer period. And the flakes, you had these huge flakes of snow falling down from the sky. And as a kid, I was really fascinated about it.
Wow. What was it about the flakes that fascinated you?
The structure, I just couldn't, it's perfect. And you just look at it and you fascinate how it was created in such a beautiful way.
Very, very cool. I love that fascination. And what inspires you today as you go about your day to day, whether it's within TailorMed or elsewhere?
Well, in TailorMed, actually, it's very easy because there is such a huge impact on patient lives. And we even measure ourselves like on daily basis. Our KPI that we like display everywhere in the company is the number of patients today we got help for them. Okay. And it's really
Interesting.
inspiring. You see this number like 5 more, 10 more, 100 more, and it gives a huge sense of satisfaction.
And so these are clients that you actually were able to match with some organizations that can help finance or help them know how much they're going to be paying out of pocket.
It's actually already approved the system, not only the matching, because once you match, you also need to enroll the application and to wait. There is some process of enrollment and approval of the application. This is like what is approved already. It means that the patient got help.
Okay, very, very cool. And so is that something that is being displayed to all of the employees that everybody can see?
Yeah. We have it on the monitors in the company.
Very, very cool. And Dina, what are 3 words that you would use to describe yourself?
Well, it's a tough one. I think it's probably strong-minded. I'm very curious, fun, and blonde, I guess.
Wonderful. Dina, thank you very, very much. Toda rabba. Thank you for the great work. And thank you for sharing the time with me. This is great. Stay safe and stay healthy.
Thank you, Michael.